Hello, everyone. It is so great to see these messages coming through in the chat. For those of you who don't know me yet, my name is Megan Sarah, and I have the immense honor of being the National Director of AmeriCorps VISTA. I'll also be your team captain for today's call. So thank you so much for joining us. And yes, if you are just joining us, please share where you're joining us from in terms of your organization. I count on and expect an active chat for these calls, so please don't let me down. I know our sponsor community are not wallflowers, so I'm hoping and counting on that being the case today as well. Welcome, welcome, welcome. We have a really, hopefully a interesting, meaningful call plan today. And so I'm eager to get to that. A few business items to get to, and then I'll be turning over to our guest speaker, Dr. Luke Schaefer, who's joining us from the University of Michigan. However, before we start, it just feels important that we mark just what has been some truly terrible events that have happened both yesterday, but really in recent weeks, and even longer than that. So I'd like to just start our call with a moment of silence to just recognize the far too many victims of gun violence that we have seen in our country in recent weeks. In Buffalo, obviously, this incredibly tragic event in the elementary school in Texas. I saw we have a lot of people joining us from Texas today, and so many other places. So while this gesture, a moment of silence, feels woefully inadequate, it just feels important that we also acknowledge these tremendous and tragic losses. So please join me in a moment of silence. Appreciate this community that we have through the sponsor community, and hope that we can continue to draw from each other, from one another, to just support each other and really dig deep into our community. So I so appreciate you making time in what I know are very busy, both professional and personal schedules for this call and for each other. I also really encourage you to check in with your VISTAs. We have seen, just like we are seeing in the rest of the country, pretty dramatic increases in terms of mental health needs among our VISTA members. You know, we had a VISTA serving right across the street from where the shooting happened in Buffalo, and that's only one of the many things that they are dealing with right now. So regardless of who they are, where they are, what they're dealing with, I just want to remind folks that we have a free telehealth service that is available 24/7 for any and all VISTA members. And this is available through the AmeriCorps VISTA Health Benefit Provider. Members through this service can access phone and video, physicians, as well as actually make appointments with a psychologist, a social worker, or a professional counselor through kind of the telehealth setup. So you can find more details as well as links in the VISTA Sponsor Handbook under the Healthcare Benefits dropdown on our website, and we'll include that link in the website. But we can't help and serve others if we don't take care of ourselves. And so I just, while difficult, I wanted to make sure that we started there. Okay, let's go through a few brief program updates, and then I'm going to turn it over to our guest speaker. So just three updates from me that I want to make sure to underscore for you. First is because you know that this is my one of my favorite topics, and something that you know, VISTAs and VISTA sponsors have engaged in such tremendous ways across just across the country. I wanted to let folks know that the getctc.org portal for non-tax filers is back up. And there's a bunch of resources on that website. Again, it's a website that's in partnership with Code for America, as well as the White House. while the expansion to the expanded child tax credits and the monthly payments are not continuing back past the calendar year of 2021. It is available to be able to get the kind of the traditional or historical child tax credit and the recovery rebate credit. And it's also really important for folks who claimed the expanded child tax credit that they filed their taxes this year so that they get the second half of the credit. So as we know, this has been really a transformative opportunity in terms of the expansions. And so I want to make sure that folks know that that website is back up with a bunch of other resources that are available for you, for the people you know, and the people that you serve. So please, if you haven't, go to getctc.org and feel free to let us know if you've got additional questions. Next up on the benefits train, I also want to make sure that folks are aware we emailed out about this, but it's really important that we underscore it, which is that in the annual budget for FY22, there was a change to our education award. So for individuals who are 55 years or older, who have successfully completed their term of service, they are now eligible to identify one recipient that they can basically pass their education award onto. There are some parameters in terms of who that beneficiary can be, but as you can see, it includes grandchildren, stepchildren, foster children, and so this is a tremendous opportunity. This is a benefit that's been available to members through AmeriCorps State National, and one that we've advocated for, including VISTA members, and so thrilled to have that available for the first time this year, and really encourage folks to take advantage of that. You may have lots of questions about that and sort of how it works, who it applies to, and feel free to just reach out and let us know. We are working on updating the functionality of the member portal, My AmeriCorps, to allow folks who are eligible and interested to do this transfer. The update will likely be done at the end of the summer, and you'll be able to do that transfer of your education award through the member portal after this time. However, if you're the small number of people, if your award is about to elapse, we have sort of a provisionary path as well. So don't let that kind of small lag in terms of the member portal prevent you from taking advantage of this benefit. Again, if you're 55 years or older and want to designate it to someone. Last big program update to me is we have some new one-pagers. So I know that folks have really been looking for some additional resources that, depending on the audience, kind of talk about AmeriCorps VISTA in a more current way. And so you'll find that on the AmeriCorps website, VISTA sponsor page. And again, we'll include that link under sponsor resources. There's things that go over their benefits, things that are more member-oriented. So we really encourage you to take a look at that, and hopefully it's helpful for your recruitment as well as kind of your partnership and just everyday work. So those are my updates. With that, I want to turn it over to our guest of honor, Dr. Luke Schaefer. I'm so excited to have Luke joining here today. As many of you know, I've been wanting to make these quarterly sponsor calls just a more helpful resource for you, an opportunity to connect with each other, learn from one another, include important program updates like the ones we just covered, provide feedback to us, and also access additional resources that hopefully will enhance and inform the important work that you do every day. And that's really kind of in the guise that I've invited Dr. Schaefer to join us. Luke Schaefer is the Herman and Amelie Cohn Professor of Social Justice and Social Policy and Associate Dean for Research and Policy Engagement at the Gerald R. Ford School of Public Policy at the University of Michigan. Luke, you win for the longest title ever. At UM, he's also a professor of social work and the very first director of Poverty Solutions, which is an interdisciplinary presidential initiative that partners with communities and policymakers to find new ways to prevent and alleviate poverty. Through his role at Poverty Solutions, Luke acts as a special counselor on anti-poverty policy to the director of the Michigan Department of Health and Human Services, and many more. His work has been cited in a ton of places, And he also published a book with Catherine Eden called $2 a Day, Living on Almost Nothing in America, which was named one of the 100 notable books of 2015 by the New York Times Book Review, and won the Hillman Prize for Book Journalism, among other awards. He was recently named to an Andrew Carnegie Fellowship. I also want to share that Luke is one of my oldest friends in the world. He officiated my wedding, so he truly is like family. We know each other from college, but including to being a tremendous friend, he is one of the smartest people that I know, and always someone that I call. He was one of my very first calls when I took this role, because he really has dedicated his life, even back in college, to focusing on those who are in greatest need and finding ways to create really smart and strategic policy that helps in the most impactful ways. So I'm really excited to have him here to talk with all of you. I've asked him to talk about his current work, the work of Poverty Solutions, and what he's doing at the University of Michigan, and also just kind of his point of view. So he's going to talk briefly, and then we're going to have time for questions and answers. Don't feel like you have to hold back. Feel free to add comments in the chat. He's going to ask you, in fact, to ask comments on the chat. This is going to be participatory, and feel free to add questions in the Q&A section at any point during the call, and make sure to get to them. So with that, is my tremendous honor to pass it to Dr. Luke Schaefer. Luke?
Thank you, Meg. It's such a delight to be here, and Meg is extremely dear to me, and I just admire the work she's done through her career. And this is exactly the type of group of people that I want to be talking to. I love that we're coming from all over the country together, working in many different ways to empower families to live healthy and productive lives. At the University of Michigan, I run Poverty Solutions. So it's a university-wide initiative, and we get our charge from the president's office at U of M to build on the great tradition of basic research at the University of Michigan about the causes and consequences of poverty and the measurement of poverty, to actually get out and partner with communities and policymakers to find what we can do about it and how we can really impact families in a very concrete, tangible way. So we have partnerships, especially with the city of Detroit, where I have a number of team members who through the years have actually worked and embedded at City Hall. All right, we got one U of M alum, which is great. We work at City Hall on a set of strategic issues around economic mobility and poverty in one of the nation's poorest large cities. We've worked a lot with the state of Michigan on different strategies to prevent and alleviate poverty in Michigan. And we do some work at the federal level as well. So I want to just sort of throw this idea out there, which is, I think when we think about poverty, right, if I say, oh, are you working on poverty? What are you working on? That there's often sort of a set of issues that immediately come to mind. A lot of times people think about our public assistance programs and how they work well, how they can work better, what some of their shortcomings are. Sometimes we might think about job training, or people might bring up transportation or childcare, right? Access to childcare. But I bet if we were all in a real room together and we put a list, everybody sort of wrote down their top 10 things of what really impacts families and what we really have to do to help empower them, we'd come up with a pretty similar list. And I think that's a really important list. And those are things that we absolutely need to be working on. Absolutely have to be thinking about affordable transportation to get people to and from school, to get people to and from work. Affordable housing, right? That is an issue that I see play out in urban communities as well as rural communities. I bet every single one of your communities is grappling with affordable housing right now. But I also kind of wonder, I sort of come to think that maybe the biggest things, right, or when you think about the landscape of things that really affect poor families, a lot of times they're issues that we've never even thought about, right? Or if you haven't had direct experience with poverty, or in your case, maybe work with families in poverty, they're not the issues that would come to mind, right? Not the things that we would tick off on a list very, very quickly. So today I want to talk about the questions that we don't even know to ask, right? Or the issues that maybe we don't even know we need to be impacting. And I want to give you a few examples from my own work in the city of Detroit, with the state of Michigan, and then in a project that I've been doing with extremely poor rural communities. And maybe you'll sort of pick up what I'm getting at, but what I want to do is invite you in the chat to write down the things that you've interacted with a client with, right? Where you realize, oh, this is something that I never thought of as sort of a poverty issue. But then as I got to know families, I realized, oh, this really is, right? This is something that really impacts them and keeps them from succeeding. So in the city of Detroit, working with Mayor Duggan and his staff, we've really sort of taken an approach of thinking of poverty as the result of a set of interlinked systems that don't work like they should. So a lot of work around poverty really sort of targets the individual. Says, how can we impact a person so that they can navigate systems better, whether it's education, whether it's financial wellness type systems, whether it's the health system, right, as Julie mentions. And that's really important work. But from our own vantage point, we want to think about how do systems sort of impact families, right? And what can we do to change systems on a systems level? And what are those things? So education and job training, and jobs, access to jobs, where are the jobs, sort of all of these things we think of as interlinking systems, and they all reverberate, right? So access to affordable housing reverberates through education and through health, right? So in our work, we want to try to think about how do we intervene in a system to change it so it works better, not just for one family, but for many families. Oh, I love this. Garbage removal is not provided by a community. What a great example, Amy. I love that, right? And we can see how that would very easily be graded by socioeconomic status and what the implications of that would be. So when I started working in the city of Detroit, if I had created that top 100 list of things that families would be really having challenges with, right, or would really be keeping families from living healthy and productive lives, not on that list of 100 would have been auto insurance. But when we started talking to families, when we were out talking with families and community convenings, with policymakers, with members of city council, it always came up. So Mike, if you'll go to the next slide, we thought we love data, right? Data makes us, that's what we're in it for. Data makes us feel warm and cuddly inside. We went to look for the best data possible. And it really shocked us, right? So we found that the average annual auto insurance premium that costs, as comparable as possible, $1,400 nationally, was pricing out at $2,600 in the state of Michigan and $5,400 a year in the city of Detroit. That is like 20% of the annual income of the median Detroit family, right? So you think about something that's just completely unattainable. This is it, right? And it turns out that this is like the confluence of a whole set of policies. There was well-intentioned policy in the state of Michigan many years ago when policymakers said, you know what, if you get into an automobile accident and you have serious health effects, you should be covered for the rest of your life. And so we have an automobile insurance in Michigan that isn't in some ways really comparable to what you can get in any other state. But it also means through the way that system sort of came down the track, that if your automobile insurance is paying your health bill to the hospital, they have to pay everything they're charged. They have to pay the full amount that they're charged rather than some sort of lower negotiated rate. And this created sort of this challenge in the state of Michigan, where there's suddenly all of these very direct financial interests to have automobile insurance covering these costs. And then the auto insurance companies, like they do all across the country, are using a set of factors to determine sort of what your auto insurance rate is. And it has things like your zip code and your credit score, right? So in Michigan, if you have a perfect driving record and bad credit, you pay more in auto insurance than if you have a DUI and perfect credit. So we created this program sort of unintentionally almost, but that there's all these financial interests sort of vested in that meant that we were expecting Detroiters to pay 20% of their entire annual income to auto insurance. So what did that lead folks to do, right? So some people drive uninsured. And that doesn't necessarily mean they sort of did the cost benefit analysis, but imagine a single mom who needs to get to work. Most of the jobs in our region are in the suburbs, right, that are sort of available to low educated folks. So she's driving to the suburbs to a job, and she can't afford her premium that month, right? So she takes one day where she decides, you know what, I don't have insurance, but if I don't go to my job, I'm gonna lose my job. So I'm gonna do it. And then imagine that she gets pulled over for an out taillight, or maybe her license plate registration needed to be renewed, or any other host of things. And then she gets a very big ticket, right? These are tickets that have gotten a lot bigger over the years because states are scrambling to figure out where to find revenue. And so they've been looking for ways to generate a little bit of money, states and municipalities. And so those tickets that you get have gotten a lot bigger. And then in Michigan, we put tickets on top of tickets if you don't pay in the first place, which is mostly low-income families. And then if you don't pay that ticket, your driver's license gets suspended. So we look at this as a structural cycle of poverty, right? You can really see how that loop is going to come. And interestingly enough, like a lot of times these issues, right, that aren't the common issues that we might think of, they don't always fall across party lines like a lot of stuff does if we think about how divided a country we are. So sort of this work that we did was a part of a discussion that led to a bipartisan agreement in the state of Michigan between a Republican legislature and a Democratic governor that tried to make some reforms. And we're still trying to figure out if we did those reforms right. We're going to see. But, you know, the fact that we were, you know, university poverty experts and didn't know to look for auto insurance until we took the time to actually start with listening and start with understanding all of the different things that are affecting families that might not be on our radar, did we know that this is one of the central things going on in the city of Detroit. In the state of Michigan, I think as a policy wonk, I really like to think about like, how do we design the perfect policy, right? And how do we get those notches right? So it's going to the folks who really need it and maybe not going to the folks who don't need it. What do we give, right? I'm actually a pretty big cash transfer type person, right? Where I say often sort of the best thing we can do is provide cash, not always, but a lot of the time. I bet a lot of you have had the experience though, that our systems of the programs that we have right now have almost this inertia of getting more and more complicated, right? We have sort of this, I think, almost this predisposition to like add more questions to an application. Oh, if we just had this more information, we could do better about eligibility or sort of tightening up sort of what we expect of people. We could ferret out more fraud. It was just better to have more information. And in the state of Michigan, actually, there's been a lot of work over the years to take in both Republican and Democratic administrations to take what was the longest public benefits application in the nation and cut it down to one of the shortest and really try to make it much more understandable. So that was work I wasn't a part of, but something I'm really proud of as a state is trying to simplify that. So while sort of figuring out exactly what that right policy is, and I think thinking about what the big policies are that can really impact families is incredibly important, right? And we should be having those conversations. I think also like this very sort of simple idea of how can we simplify what we have? How can we make the programs that we have work better for families? And one of the ways that we did that in Michigan was through asset limits, right? So as I sort of came on as a special counselor to the director, they were starting to think about, oh, every one of these different public programs. So we're looking at energy assistance, LIHEAP, TANF, food assistance, and a bunch of other smaller ones. They all had their own asset limit sort of level, right? Some were at 500, some were at 5,000, some were at 2,000. And different questions that they were asking, right? So the applications became significant. And then the second of three pieces that I want to go through is that there was a barrier, right? Of people, you know, there's the complication of filling out the form and then here's the documentation you need to bring in. I bet you've all sort of dealt with that, right? And that can really be a barrier to families where they've got in their pay stubs, they've got in their rental information, but, oh, you now need the bank account a statement from the bank account that will say that they have $100 in the bank before you can approve the benefits. And a lot of families get tripped up there. At the same time, it actually turns out when you look at the data, very, 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 very few families who come in to ask for public benefits ever have assets that come anywhere near to the levels of the asset limits that we use. And so you had a place where we were making something like much more taxing for families and probably rooting some of them out from ever getting any benefits to begin with. And it was over a set of questions that, 99 times out of 100, they were going to pass, right? That they didn't have assets that would sort of bring them up over the limit. So that led to 2 policy changes that the state made. And it is actually pretty amazing sometimes how much authority states have to think about these things, right? To change these things on their own. So the first was to standardize all the asset limits. So they all went to the same amount. It was a relatively high asset limit with the idea that, maybe we shouldn't expect people to spend off everything when they're in a moment of crisis, get rid of every single one of their assets before we provide a little bit of help. But you could really set it in a variety of places because 9 times out of 10 people have very low assets to begin with, right? But standardizing it meant we could simplify in-house to say every program is going to hit the same amounts, right? And then the second and probably more important thing was self-attestation. So in self-attestation, we say, we're not going to ask you to bring in your bank account information or this or that and come in. We're not going to keep you from sort of missing out on benefits because of that. We're gonna trust you. And we're going to say, under penalty of law, we need you to tell you this. But we're going to allow you to just tell us. And then if you don't tell us and we find out, you're in trouble. But 99 times out of 100, people aren't ever going to be at that level. So it's going to work out. And the thing that was really impressive to me is we were able to change, think of sort of not just the experience for people who are in trouble, right, are experiencing a crisis and they come in and ask for help. And you ask them to fill out all this information. And we say, we think we can get pretty much the same answer with a tiny amount of that same information. It changed the life of caseworkers. So I'm going to show you a couple slides of what caseworkers had to fill out in the old system before we made the policy change. So Mike, will you go to the next slide? So caseworkers had to fill out this page. Next slide. And this page. Next slide. And this page. Next slide. And this page. And with those 2 policy changes that we were able to make, standardize every asset limit for programs that we had the authority to standardize and allow people to self-attest, all 4 of those screens went to this page. And that was it, right? So think about not just the impact on families, right, which is tremendous, right? We're now asking people in crisis to do far less, and we're getting pretty much the same answer as we were before, but also to the caseworker. And everything that this meant, like the caseworker, think of all the opportunities that caseworkers had to make a mistake on those last 4 things, right? And then look at this, right? So I think that there's often an inertia, and every time this sort of thing gets brought up, right, these types of opportunities get back, people say, oh, well, there's federal law, or, and sometimes that's true, right? Sometimes government really ties our hands. But sometimes it actually is worth taking the time to figure out what exactly is the law and how could we change it with a goal of trying to simplify as much as possible. And I think beyond these big conversations about where we should go, what are the Medicaid for all or universal basic income or subsidized jobs for everything, sometimes this sort of simplification, right, not just in government, but in your own agencies. Can you take a look at your own forms and see what could you do to make it a little bit more streamlined, a little bit more simple for families without losing information that you need? All right, so the last example, and then I want to talk about the crazy time we're in when it comes to poverty and hardship for just a minute, and then we're going to do questions. We have been doing some work getting to know low-income communities all over in different parts of the country. So we're in Appalachia, and then in the Mississippi Delta, in the PD region of South Carolina, and then in South Texas, actually not too far away from Uvalde. And again, sort of this lesson of saying, like, when we go into a community as experts, right? As we go in as people who have been working in agencies or studying the research literature, often the things that are most on people's minds are not the things that we come in thinking about. So we were in Marion County, South Carolina, which is an extremely poor part. It's sort of not too far away from Hilton Head, just a little bit in from the coast. And as we got to know families there, we started to find out that that region had been hit by like 3 severe weather events in just a few years before we got there. And you can contextualize that, right? So thinking about this experience of this place and then contextualizing it, and all the evidence that we have is that like that eastern seaboard right there is just going to get slammed with flood after flood and hurricane in a very significant way. And we started to get to know families who lived in Sellers, South Carolina, and Nichols. So these are 2 small communities, 2 great communities. Sellers is 90 to 95% African American, and Nichols is a much more a racially mixed community, probably 50, 60% white. And both communities were tragically just sort of slammed by Hurricane Matthew and Hurricane Florence, and a severe flood before that. They're right on a river. And so when these floods come through, when the hurricanes come through, it's really the flooding, which is the biggest challenge. But we did started to notice that in Nichols, things looked a little bit better, right? Things were moving along in terms of help. In Sellers, people were saying, I applied for help, or I didn't even bother to apply for help because I'm not going to get any help, and I know that. So if you look at housing assistance from FEMA, this is the individual and households program, and just in these 2 communities, we can see sort of at every stage in the process, pretty significant differences. Then percent of homes that were inspected, right? So this is the first step. If your home was destroyed, like having someone come in and inspect that is the first thing. You can see there's a big difference in who gets into that first step. Then there's a big difference in the amount of expected damages, right? So if you are, FEMA says that you should get something, in Nichols, the average is $11,000, $12,000. In Sellers, it's $2,000. The percentage of inspected homes that get any aid, right? There's a 20 percentage point difference between those. And all of those things add up, right, to Nichols. So these are relatively similarly sized communities. Nichols is like a bit bigger. Maybe we'd even say 2 times bigger. But Nichols, just from Hurricane Florence, received $1.1 million in aid. To Sellers that got $51,000, right? So to us, this is sort of where the nuts and bolts of, honestly, structural racism, right, comes into play, right? We see at every stage of the process, just distinct differences. And looking into these, right, you can see how graded by race they are. And all of these at every stage of the process, right? Some of this has to do with the inheritance of property, right? So many low-income African-American families have inherited their property over the generations, but haven't gone through sort of formal inheritance processes. And so when they came up to try to get aid, FEMA would say, well, you can't actually prove that you own the home. You've paid property taxes, you've been paying the bills, you've been paying the upkeep, but the home is in the name of your grandfather. And so this basically means they're categorically ineligible, right? And then what are the quality of homes and how much money do we assess, right? Are the monetary damages from where the housing stock was before to where it is now, right? That's another phase. And all this adds up to many times sort of difference. And you can see this in the aggregate, actually, across the nation. So when a predominantly white community is when a predominantly white community is hit by a hurricane or any sort of severe weather event, a new study finds that in the short term, right, it's terrible. It's such a crisis. And I would never want to discount sort of what happened in Nichols, South Carolina. But in predominantly white communities, those communities actually end up wealthier over time. They actually have a financial benefit because of the dollars flowing in, versus predominantly communities of color end up less wealthy, right? They actually, compared to other centers, we got the Center for Heirs Property assist with some of this. It's such a, Carolyn has some experience with this, right? They're one of the groups that we've gotten to know through this. So communities of color actually go the opposite direction, right? Where they become, they lose their assets compared to other Black communities. So you have government policy that actually, it doesn't just sort of keep sort of racial disparities in wealth even across a crisis, it actually ratchets up those disparities. And it's not because there was intent in that, but when we don't look at history, right, when we don't think about the context of how each one of these stages of the process may have disparate outcomes, we see that it really adds up in a very unjust way. And so to us, sort of thinking about how structural racism, sort of the nuts and bolts of that, end up playing out and figuring out how do we intervene in a meaningful way to make things better for places like Sellers. So FEMA, as a result of the work of many people now, is trying to create a different way to prove home ownership than they've had in the past, as to try to make it easier for folks who are heirs property owners. All right. One last thing, I'm going to make it really quick because I want to get to the conversation. We can go to this very next slide if you don't mind. So when COVID first emerged, I was completely panicked about the economic crisis, and I completely did not understand the severity of the public health crisis. But I have to say, right, as somebody who's been studying poverty for a long time, has been doing this work, I was completely astounded by the response of the federal government. We had the economic stimulus payments, we had expanded unemployment insurance like we've never done before, and we had the child tax credit, which is something that I had been working on for a long time and was incredibly grateful to see. And the result has been pretty astounding. I think it's the thing that folks have missed the most, is that the economic circumstances of low-income Americans were really buffered during this economic crisis in a way that they never have before. And you can see this in a brand new chart. This comes from the Federal Reserve Board. They have a report that they release every year, the economic well-being of US households. And I just provided one chart, but you can look at all of them. It's pretty amazing to see. This is just a question of like, are you doing at least okay financially? And they've been asking this going back to 2013. And the overall trend line, 2021, saw the highest proportion of Americans saying they were at least okay financially that they'd ever been before. In 2020, when we lost 20 million jobs, right, in a matter of months, we saw it basically stayed stable that year, went down just a little bit. In previous recessions, it would have just plummeted. And the thing, all of these numbers that pop up, and you can see for every racial category, pop up a little bit or a lot. The concentration for 2021, right? So when we see that good news in 2021, is completely clustered among parents with children. And so we can see like these extra policies that we did, especially the expanded child tax credit, seem to have an impact. And at the same time, we've got lots and lots of challenges, right? And a lot of these policies have gone away. So we're going to see where we are going forward. But I do think it's worth taking a moment to really recognize what was a bipartisan, a lot of these measures were bipartisan sort of success that we had during this time, and thinking about what that means for how we should do things going forward. All right, I'm going to stop there. I can't wait to talk about your questions and whatever you'd like to talk about. We can take the slides off if you like, or whatever we want to do.
Thank you so much, Luke. So many things. You covered so many things. And I'm, of course, with federal resources, we don't focus on advocacy or policy changes. And I think your presentation around simplifying, using that user perspective is such a powerful one. I was like inwardly cringing when I was thinking if you were going to do the equivalent of e-grants and the member portal,
Yep.
because we could rival the state of Michigan in terms of difficulty for our primary users. So welcome folks to ask questions. Please add them in the Q&A. We've got about 15 minutes left, and I don't think you want to just hear me and Luke talk, but though we can do that, we have no problem doing that. One question I had while we wait for folks to add some, and we've answered a few that have already come in, but and if you have questions about VISTA Business too, we welcome those as well. So don't hold back, folks. One question I have for you, Luke, is you know, we're going through a lot of reckonings right now, or reckoning again with things, economic injustice, racial injustice, and also kind of grappling with the reality of what is truly profound climate change. And I was just having I'm actually talking to folks from West Virginia this morning. This is where I am, is West Virginia today. And I was talking with a colleague about just the intersection of those things, which I think really is VISTA's sweet spot. And I'm just interested in your thoughts around, as we work with individuals who have such immediate, you know, kind of first order needs in terms of those who are in deep poverty, kind of what role do you see issues around climate change, which we know disproportionately affect people in poverty. We know that they disproportionately negatively impact people of color. So I'm just interested in your thoughts about kind of the intersectionality of those three issues.
Yeah, I think thinking of them intersectionally is the first step, right? And really trying to bring them together, because I have felt for a long time that these conversations sort of go, they're in their own silos. And so we don't think of sort of sustainability as also being related to poverty and affordability. And so trying to think about how do we bring those conversations together, to me, is the first step. And I think some of it has to do with, like, the first triage to me is making sure that our programs that support families in when they experience a crisis don't exacerbate our challenges with racial and socioeconomic inequality, right? And then a second part, I think, is sort of actually investing in preparing communities, right? If we're going to have these experiences more. And for example, in the city of Detroit, we're just having a ton more flooding than we've ever had. We have lots more power outages because we're having significant winds, right? And different kind of weather experiences. And I think, you know, we're not really that good sometimes we sort of treat this crisis. You know, I have a lot of friends who live in the city of Detroit, their basements all flooded. Because the infrastructure is not ready for this kind of flooding. And it's time for us to really, I think, try to think going forward and think about how do we prepare and protect our places for this, and sort of understand that, like, this isn't just a one-off type crisis. I also think there's a lot of really interesting ideas of, you know, can we bring things together? So in the city of Detroit, how home repair is a big issue, right? So in the affordable housing crisis, we have a lot of housing stock. We've had a big tax foreclosure crisis, and our housing stock is all pretty old. And so we've been doing a lot of work with community-based organizations and the Gilberts to try to bring the quality of the housing stock up. We just announced a program where we're going to do, I think it's $20 or $30 million to replace roofs, which I think is great. And that's going to help with sort of, you know, just a little bit with heating costs and the use of heating. I think it would be great in sort of the next iteration if we're thinking about putting solar panels on top of all of those homes. And that is it's a significant sort of investment in the moment, but it could benefit low-income homeowners, right, who would see all of their monthly bills go down, and also reduce our energy, you know, our dependence on fossil fuels. So I think trying to think creatively about how we bring these things together and bring them into conversation. Zoning is a big one, right? So community zoning is most places have really restricted laws that about this is the kind of thing that you can build. And I think we could be a lot more flexible, right? With like auxiliary housing units, different things. I actually think sometimes like zoning, I do have this, like there is this, I think, very good libertarian argument that we've made it too expensive to build housing of a particular style, which is also, impacts the footprint, the energy footprint. So I think it thinks creatively. It starts with bringing them together and then sort of thinking about the long term. How do we look both to sustainability and also at the same time bring in the affordability angle? I wanted to say, I think the systems level approach, real quick, Meg, it does, sometimes that means like going to your policymaker and saying, we want to change in this bill or that bill. And I know that that's something that the federal government can't do. I do think sometimes these things are like practical changes, right, to our own programs. And as you were saying, like, I hope people will take the ideas. A lot of this stuff really, when I've thought like this is the type of thing that often gets me talking to people I never imagined I would talk to, sometimes administrators in my community, sometimes, different just levels, transportation, right? How can we have like really practical changes to our transportation systems? So I do think it's sometimes possible to sort of work on the structural stuff in a way that crosses no line in terms of like formal advocacy.
Right. So much there. We've got a bunch of other questions that have come in. Susan asks, the example of cutting down on paperwork that you gave is a profound one. You got a lot of comments and wows in the chat from that, but it does require kind of taking a step back and having the resources, both time and funding, to be able to have fresh eyes. How do you recommend regular people trying to tackle that while doing our everyday jobs every day, every week? How does one start?
Yeah, so I think the first way might be that I think sometimes I don't exactly know what Susan's working in, but let's imagine she has staff who interacts with families, who fill out forms, who talk about the other experiences they have, right? I think there could be like, you could kind of make a fun thing out of it, right? And say every week at the staff meeting, I want, folks to bring the ideas that they have that could simplify how we run our programs. Like, what is one needless step that we have? And sort of challenge folks, because I think a lot of times those things will become apparent through the course of the work that's being done by people. The acid test is an example, right? Where caseworkers might say, hey, when I have to fill out 4 screens, 4 complicated screens, that's taking me a half an hour or something. And that's the place, and nobody ever is above the limit. So why don't we get rid of that? Or, hey, when we route our customers this way, it seems to just create this backlog over here that then affects this other thing. So you might just try for a couple of weeks and say, hey, at our weekly staff meeting, bring your one idea that would simplify. Some of it's a little bit of like starting with the culture and sort of, I've got a piece that I'd be happy to, I'll share with you, Meg, and we could share with with sort of some examples of this. So getting people thinking about it, getting the juices flowing, and then asking them to come together. And then I think the next stage could be, you could just have like one meeting where, let's say you have an application. Let's all just come together and look at the application and really sort of say, what do we need on this, right? Are there questions? Let's have a working group session, like what could we get rid of? And I think a lot of times you might hear, oh, we can't get rid of that. That's like, this other policy. And that's sometimes when the rubber might hit the road of saying, like, do you have enough energy in the room to go back and sort of track that stuff down? Because a lot of times, really, actually, you do have the authority, right? It's, I think because of the way our systems are set up, we get really worried about that stuff a lot of time, and just going back and actually making sure that that's correct is a piece of the puzzle. And that might take some work, but again, you're going to benefit from it in the long run, right? If your systems are working better over the long term, then there is some upfront costs, but it could really benefit you over the long term.
And there's like in design thinking, core tenet is to think of a corollary, right? And I think that's why you sharing the examples are so helpful. It may spark, hey, I just learned about this example from Michigan, what's a relevant thing in our work that may be similar and can spark different types of creativity. Bruce, I'm going to try to squeeze in 2 more questions, though we've got much more than that. So Carolyn asks, it's actually the perfect follow-up. When you loosen things and sometimes simplify things, the common argument is, well, that's going to lead to program abuse. How do you counter that?
Yeah, so I think evidence is really the way to counter it. And you might decide, what we did with the asset test, we said, hey, we're going to put this in, and then we're going to really look at it over 6 months and a year. And we're going to see, do we think that there's concern here? And in that particular case, no, there wasn't concern. And it really does turn out that a lot of our programs, like public benefit programs, at least, I'm going to talk about one counterexample here, but in public benefit programs, they, not a lot of people are trying to, mostly people are eligible for it, right? So there are examples, and that is one challenge, right? It's you might make one of these changes, and then there'd be a case, right? And there's so much policy that's made over sort of one example, high profile example, that isn't indicative of everything else. So I think responding to that one example is important, but also you do have to make the case of yeah, that was one example, but we can think about that in any system, right? Where somebody has sort of gotten away with something, and we don't know if it's actually any better or worse because of this change that we made. I actually do think that fraud prevention is something that we should spend more time thinking about. So I think some folks think about it so much, and we put so many barriers in the system to reduce it that we actually, a lot of people get left out, and I don't think that's okay. Folks sort of who really believe people should get benefits tend to say there's no problem with it at all. And I think that sometimes leads them into trouble. So we had some trouble with the expansion of unemployment insurance during COVID, that the eligibility became so open that a lot of states really got taken advantage of. And so I do think that there should be more thinking about what are the right policies to prevent fraud. And I think there's some things that we can really think about where we have systems where we can sort of check identities after the fact, under the hood. So nobody who's, it's not we're not putting the burden on the clients, we're putting the burden on ourselves, and then following up with people who maybe get flagged, right, in a serious way. I think there are some models, but it is something that actually even folks who really think families, 99 out of 100 families really need the benefit, deserve the benefit. We do need to think about that. But the goal is to figure out how much of the burden can we take off of the shoulders of this person in crisis, and so that if they're doing right, they would never see it, but we're still going to catch the people who are trying to abuse the system.
Last question, 1 minute or less, because I didn't get to all the questions, and so I think this call has brought up a lot for the VISTA community, and I'm thinking both about our sponsors as well as our members. What are ways that they can continue to follow your work and take advantage of the great resources that Poverty Solutions provides?
Great, yeah. Well, I think we put the website in the chat, poverty.umich.edu. You can read about land contracts. We've been doing a lot of work around actually how land contracts can be a path to home ownership for people without assets. We're writing some on water accessibility. We're writing on auto insurance, obviously. We have a newsletter that you could sign up for there. And then we love to talk to folks. So you can feel free to email me, and I will probably, if you have a specific question, something you're working on, I will probably connect you to one of our team. But we'd love to especially hear about those things that you think impact families in poverty that nobody else has ever thought of. And maybe we can do some of this work together and really find concrete, tangible ways to empower families to live healthy and productive lives.
Great. Thank you so much, Luke. And I'm going to ask my colleagues to put the link to Poverty Solutions again in the chat so that folks have it, because we've got an active chat, just like I was hoping for. I also want to acknowledge there's a bunch of questions and comments about the living allowance for VISTA members. And I think, as folks know, we've increased it the last 2 fiscal years. Absolutely agree that it needs to be higher, and that I would like to see it higher. That really involves, we want to make a change that we can sustain. So those are conversations that are very much underway. But I share the sentiment, I share the desire, and know that when we think about VISTA, we all know the power that the VISTA program can have, particularly in building capacity that lasts long term, but that only works if the program is accessible to everyone, and if people can successfully complete the program. So many of the changes that Luke is talking about applies to policies or systems or procedures, but it gave me a long list of to-dos, even for our own program. So thank you so much for your engagement. I hope that folks do take advantage of Poverty Solutions. And before you hop off, if you could fill out the survey. I think, as I mentioned at the top of the call, we are experimenting with a bunch of different kind of ways of viewing this sponsor call, hoping that it's adding more value to your work. But we only know that if we hear directly from you. So thank you in advance. The Survey Monkey link is in the chat, and just encourage folks to, as well as on the screen, encourage folks to fill it out. Give us your feedback. As always, we love the candor. Thank you so much, Luke, for joining us and inspiring us with your creativity, your insight, and positivity, particularly during a hard week. So we really appreciate you and all that you do with the team at Michigan and Poverty Solutions.
It was my pleasure, and I so appreciate all of you and the work that you continue to do, and I'm excited to be a little bit of help.
All right, take care, everyone, and I hope that you can join us on our next quarterly call. We'll be hearing from the Office of Research and Evaluation, so it will be a great call, also one that's chock full of data. So thanks, everyone, and thanks again, Luke. Take care.